Hey, this is Jeremy, and today we're going to be talking about interview techniques. Interviewing is a very critical skill that is underutilized, and we need to be able to accurately obtain information and make sure that it's reliable, make sure that it's usable, and we need to make sure that we're obtaining it the right ways. There's things that you should do, and there's things that you should also never do when interviewing, and we'll be talking about those. One of the first things is going to be reflection. That's whenever you are using the patient's own words or phrase or something that they said as a way to kind of expand on that information that you got. So, for example, if you have a chest pain patient who is they're saying they're having a hard time breathing, and so you ask, it's hard for you to breathe, or can you describe how it's hard for you to breathe? And they're like, it's because of my chest hurting that I just can't. I don't feel like I can catch a full breath. And that's using that information, you need to decide, is it going to be a cardiac problem or is it going to be a respiratory problem? And asking those questions and getting them to expand on that little bit of piece of information may help guide your treatments. Next thing is going to be empathy. Empathy is essentially the ability of you to be able to put yourself in somebody's shoes and at least understand that they're feeling certain emotions. This doesn't mean that you have to completely know exactly what it's like to be in their situation, but you at least need to know that if they just lost their wife or they just lost their child, that is going to be a very stressful, a very sad situation. And you can say, well, I can only imagine what it would feel like, or understand that they are actually feeling something that's not necessarily a good thing. Next is going to be confrontation. Confrontation is that's a method that really needs to be utilized under certain situations, and it doesn't need to be overutilized. Whenever you confront somebody or using the confrontation technique, what that means is that let's say you have somebody who got into a car wreck, and you ask them, oh well, do you ever drink? And they're like, yeah, I do, but I didn't do it today. And you're like, okay, well, why? Can you tell me, how you wound up here? It's like, I don't know. It's like, well, I see the beer bottles in the back of your truck and I smell the alcohol. So I'm just letting you know there's some things that aren't quite adding up to your story, and it's really important to know the truth. And in that sort of confrontation technique, you may get that they've drank a little bit, or that they've done some drugs, but you need to be careful whenever you utilize that technique, as it can come off too assertive, and especially on your demeanor and the rapport that you've been building with that patient or those bystanders, it may work for you or it may work against you. So just kind of be careful whenever utilizing that, but it is a very reliable technique to use whenever the circumstances arise. Next is going to be interpretation. This is going to require some intuition on your part, and your ability to look at the environment, look at the patient, look at the people that they're there with, and understand the certain nuances of that situation that may occur. So, for example, if you have a 13 to 17-year-old girl who is upset or depressed, and that's what you get called out to their house for, and mom and dad's like, hey, you know what, I just want her to go get looked at. And she's down, she doesn't want to talk, may have some abdominal pain, and she could be upset and inquire about if she's pregnant, especially if she's not going to open up about it. We need to ask that question of every child, or every female of childbearing age. And so you understanding that most teenage moms, their parents don't know that they're having sex, but they also may not necessarily be supportive, or she may have not grown up in an environment where she can openly talk to her parents like that. So, but you still need to obtain that information and understanding and asking the things that in a professional way that's not going to be demeaning to the patient, and that's going to respect their privacy even as a minor. Those are all important things to consider. Facilitation is something that we use whenever we're trying to encourage a patient to answer. So if you have somebody who's hesitant about opening up about something, so for example, have you smoked any marijuana, or have you done any drugs? No, no, no. Well, okay, well, I'm not the cops, and it's really important for me to understand, what you may have been going through in the hours coming up, building up to this, and that's going to help us treat you. I can't arrest you, and you're not going to be in trouble for doing any drugs. So I just need to have that information. Well, that's a method of facilitation. You're not necessarily coercing an answer out, but you're allowing them to understand the context of the situation, and that you can, and it's just a way for you to be able to get, again, that accurate information. And if you try to facilitate that answer and they're still adamant about whatever it is that they said the first time, then you're going to have to back up and punt and try to obtain other information, because that's going to be a piece of information that they're not going to give up. Also, understand silence. When to be quiet is really important. It's just like, knowing when to not do something is important. Knowing when to do something is important. Know when to not talk and know when to stay silent. Those are silence is very important, especially if you have somebody who may be having a hard time putting what they're feeling into words. You'll see this in sometimes the elderly patients, not because they're not quick-witted or because they're slow to speak or anything like that. It's just they're trying to think of the right words. And so just kind of utilize that. Allow people a couple extra seconds to think about their answers and to talk. Because they know just as well as everybody that as soon as you say it, you can't ever take it back. Next, use clarification. So, for example, if you say they have somebody that has my chest hurts. Oh, well, where does your chest hurt? Or you say you have chest discomfort, and then you ask about chest pains. It's like, no, this isn't pain. This is chest discomfort. I'm not hurting. My chest just does not feel right. Right, and that's another thing. So clarification, you're going to utilize that whenever your patient says something and you're just trying to clarify what's going on. So if they have, again, going back to that example from earlier about your chest pain patient having a hard time breathing, or you say you're having a hard time breathing. No, it's just I can't get a good breath in because of my chest hurting. Okay, well, that's that clarifying piece of information. Whenever you have your psychiatric patients or anybody who's in a stressful situation, they may not want to talk about something. You need to provide them redirection back to the subject at hand and to be able to provide an answer. Just like with the confrontation, if you have somebody that's not willing to give that information, regardless of however you try to obtain it, you may need to ask a different question, because you're not going to be making any progress if you're asking the same question over and over and over again and they keep redirecting to something else. And you can always simplify, or simplification and summarization. And so with these, it's very similar to clarification, but you're trying to put your patient's comments into your own words, and that's going to allow you clarity. Because whenever you say it, especially if you have somebody who has a disorganized initial report to you, you can ask for that clarifying and summarize what it is that they're saying to you. And those are all the interview techniques that we can use. Now, there are some things that you never need to do. You should never lie to your patient, and you should never provide them false information. If they ask if they're going to jail, say you don't know. I don't deal with the law enforcement side of this. Do not talk about things you do not know. If they ask about a disease process and you're not familiar with it, don't talk about it. You can say what you know about it, but do not go above that. And that's going to go to, do not lie to your patient. Do not pretend to know about something that you have no business talking about. And do not ask leading questions. And so what this means is, so do not try to get your patient to admit to something that they may or may not have experienced, such as, hey, do you have a headache, or do you have blurry vision? Allow your patients to describe what was going on, because they may not have had a headache, they may not have had blurry vision until you said something about it, and now they are presenting with those exact same signs and symptoms. Do not interrupt your patient, and always avoid closed posture. So do not sit with your hands in your pockets. Do not stand with your arms crossed, because this can be seen as setting up a barrier, and you're not going to be receptive to what the patient is saying or what the patient is doing. And always respect your coworkers that you're working with, whether it be fire, EMS, and police. Do not disrespect them in any shape, form, or fashion, because your patient is going to see the disrespect that you give to them, and they're going to see how your coworkers react to you, and that's going to start helping or hinder your rapport with that patient. If you're seen as disrespectful to your coworkers, how is that patient? How are you going to act with that patient? And that's something that's really important to understand, and not a lot of people, I feel, understand that one, because respect does work both ways, and it's important to earn your patient's respect just as well as it's important to earn the respect of those around you. So these are the interview techniques that we need to utilize, and those are also the things that we need to never do to our patients. So just keep these things in mind whenever you're communicating with your patients and you're attempting to obtain that information. And that's the interview techniques.